Assalamu alaikum. I'm Dr. Rabia Sajad from Anatomy Department, Sahara Medical College, Narwal. Today, the topic of discussion is neurovascular bundle of gluteal region. Previously, we discussed the muscles of gluteal region and the gateways through which these structures, the neurovascular bundle, is going to enter the gluteal region from pelvic cavity. And now we are going to discuss what is their origin, what is the course, and how are they distributed in the gluteal region. So we previously discussed gluteal region. Here you can see that the gluteal region starts from the highest point of iliac crest, which is almost at the level of the disc between the vertebrae L4 and L5, and is up to the gluteal fold, which you can see here. And it is formed mainly by the outermost surfaces of hip bone, the outer surface of ilium and ischium. There are also some important ligaments related to these bones, and these ligaments are the sacrospinous and sacrotuberous ligament, most importantly, and then there are other ligaments which are supporting the joints. Piriformis is the key muscle in the gluteal region. You can see in the diagram that it is passing through the greater sciatic notch, and it is dividing the neurovascular bundle in two major groups. Also, the largest nerve of the body, sciatic nerve, it is going to be passing through the gluteal region and then enter the back of the thighs. We discussed that the muscles of gluteal region are divided into superficial and deep group. The superficial groups include the three gluteae and the tensor fasciae lata, while the deep group consists of piriformis, obturator internus, the gemelli, and quadratus femoris. I considered the gemelli as a pair. That's why I said there are 8 muscles. If you consider them separately, then total muscles are 9. In KLM, it is mentioned that the superior gemellus, inferior gemellus, and obturator internus, these 3 muscles can be called as a single muscle named triceps coxae, or the triceps of hip, as they are inserted together and they act together to produce the rotation. We also discussed that the superficial muscles are extensors and abductors, while the deep muscles are the small rotators. The sacral part of the lumbosacral plexus is shown here. Here we identify the nerves which are going to enter the gluteal region and are highlighted and numbered. Number 1, we can see the sciatic nerve. Sciatic nerve is not a single nerve. It has 2 different bundles arising from anterior and posterior deviance of the primary rami, and these 2 bundles are known as common fibular part and tibular part. Here they are packed together. When the sciatic nerve enters the popliteal fossa, it divides into its proper branches, the tibial nerve and common fibular nerve. Then we identify the superior gluteal nerve, which is coming from the posterior deviance, which are shown in yellow. And then the third one is the inferior gluteal nerve. These 2 are passing through the greater sciatic foramen above and below piriformis. Then the number 4 is posterior femoral cutaneous nerve, or posterior cutaneous nerve of thigh. And we have nerve to obturator internus here labeled 5, and then the nerve to quadratus femoris, and the last one here labeled is the pudendal nerve. The distribution of these nerves will be discussed in the next slides. So among the vessels, we identify superior and inferior gluteal arteries, and also the accompanying veins, which are going to enter and are distributed in the gluteal region. Other than that, internal pudendal vessels also are going to enter the gluteal region, but they exit through the lesser sciatic foramina into the perineum. We can also trace the origin of this gluteal vessels. Looking at the aorta lying along the posterior abdominal wall, we can see that it is terminating in two common iliac arteries. Each common iliac artery in turn terminates as external and internal iliac arteries, and superior and inferior gluteal arteries are branches of internal iliac artery arising in the pelvic cavity, and the superior gluteal artery is passing above the piriformis and inferior below the piriformis to exit the pelvic cavity and enter gluteal region. The skin of the gluteal region is supplied by three main groups of cutaneous nerves. First of all, you can see superior cluneal nerves arising from the dorsal rami or posterior rami of L1, L2, and L3. It travels along the posterior abdominal wall and crosses the iliac crest to reach the upper part of the gluteal region. Then you can see the middle cluneal nerves, which are basically branches from posterior rami of S2, S3, S4, and as the sacral plexus or sacral nerves are present, emerging towards the pelvic side, these branches reach the gluteal region by passing through the posterior or dorsal sacral foramina. And the third group is inferior cluneal nerves. Here you can see that these nerves are arising as branches of posterior cutaneous nerve of thigh. Now the important point to remember is that the superior cluneal nerves and middle cluneal nerves arise from posterior rami of lumbar and sacral spinal nerves, while inferior cluneal nerves are branches from the anterior rami, as posterior cutaneous nerve of thigh arises from the anterior rami. Now looking at the cutaneous distribution, you can see that skin of the gluteal region over the iliac crest and most of the ilium, that is supplied by superior cluneal nerves, and the skin over the sacrum towards the medial side is supplied by medial cluneal nerves, while the anterior small part in the upper outer quadrant is supplied by lateral cutaneous branches of iliohypogastric nerve, that is L1. In lower part, we can see that part or outer quadrant is supplied by the lateral cutaneous nerve of thigh, which gives posterior branches, and then innermost part is supplied by the inferior cluneal nerves, which are branches from posterior cutaneous nerve of thigh. These landmarks, you can see again revising these landmarks. You can see the pelvic surface of ilium, ischium, and pubis here. This is the obturator membrane. These are the ligaments of sacroiliac joint. And the most important ligaments here are anteriorly or more toward the pelvic side. You can see sacrospinous ligament starting from the lateral aspect of sacrum up to ischial spine, and then more posteriorly or outwards is a sacrotuberous ligament starting from the lateral aspect, posterolateral aspects of sacrum up to ischial tuberosity. These two ligaments are converting the two notches into foramina, the greater sciatic foramen and lesser sciatic foramen, as we have already discussed. And then we can see here that piriformis is the key muscle here, which is going to divide the greater sciatic foramen into two parts. The part above the piriformis is called sometimes a suprapiriformis foramen, and the part below is also called infrapiriformis foramen. So you can see only superior gluteal nerve and vessels are passing above piriformis, and a large number of other structures are passing below piriformis, which we'll identify in the next slides. Now, contents of sciatic foramen above the piriformis, or should we say suprapiriformis foramen, are superior gluteal nerves and vessels. You can see here that superior gluteal nerve is going to supply gluteus medius minimus and tensor fasciae lata, and superior gluteal artery supplies gluteus medius minimus, tensor fasciae lata, as well as gluteus maximus muscle. Now, structures passing below the piriformis or infrapiriformis foramen, you can assess that the medial most structure coming out of it is the pudendal nerve and internal pudendal vessels, which are going to enter the lesser sciatic foramen immediately and go to perineum to be distributed. Then we can see the small nerves, nerve to obturator internus, which is going to supply obturator internus muscle and the muscle close to it, the superior gemellus. Next, we observe inferior gluteal artery and inferior gluteal nerve. Inferior gluteal artery is going to supply part of gluteus maximus and then the small deep muscles, while inferior gluteal nerve is only going to supply the gluteus maximus of the superficial layer. So in case of blood supply, gluteus maximus gets its supply from both superior and inferior gluteal arteries, while in case of nerve supply, the gluteus maximus is supplied by superior gluteal nerve, while gluteus medius minimus are supplied by the superior gluteal nerve. Then we see the posterior cutaneous nerve of thigh. After giving the cutaneous branches to the gluteal region, it is going to enter the thigh. And we see the nerve to quadratus femoris, which is going to supply quadratus femoris and the inferior gemellus lying close to it. The sciatic nerve is the lateral most structure passing through this region. Sciatic nerve is not going to supply any structure in gluteal region. It is going to pass on to the posterior compartment of thigh, where as a complete nerve it supplies the hamstrings, the muscles of the posterior compartment of thigh, and then at the superior angle of popliteal fossa, it is going to divide into two parts: the tibial nerve and common fibular nerve, which is distributed in the leg. Just a quick revision of the structures passing through lesser sciatic foramen. Tendon of obturator internus is coming out towards the gluteal region, and then nerve to obturator of internus is going to supply the gluteal part of obturator internus and superior gemellus, and then it is going through the lesser sciatic foramen to enter and supply the pelvic part of the obturator internus muscle. So it is going in the reverse direction from gluteal region, first supplying some part of these muscle and then towards the pelvis. Pudendal nerve and internal pudendal vessels, which had entered the gluteal region through greater sciatic foramen, are now exiting it and entering the perineum. Reviewing all the nerves, we can see that superior gluteal nerve arises from the posterior divisions of L4, L5, S1 spinal nerves from the sacral plexus, while the inferior gluteal nerve is a step down. It arises from L5, S1, S2 spinal nerves, the posterior divisions of their anterior rami. The superior gluteal nerve passes between the gluteus medius and minimus. Here you can see the cut part of gluteus medius. So this is traveling between these two muscles and supplying these muscles, and in the end it reaches the tensor fasciae lata muscle and ends in supplying it. Inferior gluteal nerve enters the gluteal region passing below the piriformis muscle, and then it divides into several branches to supply the gluteus maximus muscle. Now, nerve to obturator internus and nerve to quadratus femoris are also step up and step down. Nerve to quadratus femoris is L4, L5, S1, while nerve to obturator internus is L5, S1, S2, and they arise from the anterior deviance of anterior primary rami of these nerves. Nerve to obturator internus also supplies superior gemellus. We can remember this relation by SO4, superior gemellus and obturator internus, while nerve to quadratus femoris also supply inferior gemellus. We can remember this relation as IQ, inferior gemellus and quadratus femoris. Rest of the nerves will be described with the back of the thigh. Now, reviewing the vessels, you can see that superior gluteal artery, after entering the gluteal region, passing through greater sciatic foramen above the piriformis, it divides into superficial branch and deep branch. Superficial branch is going to supply the gluteus maximus muscle, while the deep branch is running between the gluteus medius and minimus muscle along with the superior gluteal nerve to supply them and reaching up to the tensor fascia lata, just like superior gluteal nerve. Inferior gluteal artery enters the gluteal region by passing below the piriformis through the greater sciatic foramen, and here you can see that it is going to be supplying gluteus maximus muscle and then the deep muscles of the gluteal region. These two vessels are going to anastomose around greater trochanter, and then also at the back of thigh. The two anastomoses are called trochanteric anastomosis and cruciate anastomosis. These two will be discussed with the back of the thigh. Superior and inferior gluteal veins and internal pudendal veins are formed in the reverse direction. As the superior and inferior gluteal arteries are branches of internal iliac artery, the superior and inferior gluteal veins are going to drain in the reverse direction, exiting the greater sciatic foramen and entering the pelvis, ending in internal iliac veins, while internal and external iliac veins join to form the common iliac vein, which drains in inferior vena cava. Lymphatic drainage of the gluteal region can be divided into two parts. The superficial lymphatic drainage, which is towards the superficial inguinal nodes. You can see the lymphatics from the skin and superficial structures are coming towards the superficial inguinal lymph nodes. Most importantly, the outer part of the horizontal group, and then the deep lymph nodes, which are draining the deep structures of gluteal region, are lying along the superior and inferior gluteal vessels, and they are the superior and inferior gluteal lymph nodes, which are going to drain into the iliac lymph nodes, the internal iliac and then common iliac lymph nodes, and then they are going to drain into the para-aortic or lumbar lymph nodes.